I'd like to use my 5 minutes, it might be slightly more, but to make a number of points about how we see things in Telford in the wake of Matt Hancock's decision to uphold the future fit plans. Albeit, as John has just said, with the proviso that PRH can become an A&E local. And as John said, nobody knows quite what that is. We have a bit better idea if you've seen the Shropshire Star today. The headlines, it's a part-time A&E, but more than that, it's an A&E with, as far as we can tell, without the beds and without the backup. If it was anything more than that, that fig leaf, which is what it is, if it was more than that, it would actually undermine future fit. So the whole model would come crumbling down if they were to put those beds in, if they were to put that backup in. So it's a lose-lose in terms of any way they want to project this. But the fact that Matt Hancock has now pronounced his decision makes this a political decision. With the lobbying by Tory MPs in Shropshire, it always was, of course. But it is now out in the open and harder to pin the decision on NHS managers, as one or two of our Tory MPs would like to. The first point has to be the obvious one, I hope, that Future Fit is not in the best interests of the residents of either Telford and Wrekin or Shropshire. In an area as geographically as large as this, both the east and west need their access to fully functioning A&E. If you have doubts about this principle, just take a look at the A&E waiting areas at the RSH and PRH and the difficulties hard-pressed staff are having in coping with demand. And then ask yourself if putting another journey to a hospital 15 miles away for those in need is going to help or worsen the situation. The second point is that even if you believe that one A&E is right in principle, the model relies on investment in primary and community care that will divert patients away from the front door. Future Fit actually started with good intentions of doing this, but it ended with nothing to invest in the health economy here, and as the health economy here got into more and more difficulty. Future Fit, in other words, became a cuts programme, with reductions in staffing and assumptions about primary care picking up the slack. Thirdly, and this is a fundamental issue for Telford and Wrekin, under the plans agreed, the PRH will lose its consultant-led Women and Children's Centre. It was opened 5 years ago, based on clinical need in a borough that has 15 areas that are ranked in the 10% most deprived nationally. Now it will move to the RSH. This, more than anything, has been a red line for us in Telford and Wrekin. The fourth point concerns the 312 million of investment that John talked about, and that the Tory MPs are shouting to the rooftops about. First of all, it's a loan, not a grant, and it will cost our cash-strapped health economy 11 million a year in repayments. Secondly, it's going into building infrastructure rather than services, mainly the RSH. If you've walked around parts of the RSH, you will see the results of years of lack of investment and why money is needed. On the other hand, you might question whether propping up this crumbling building is the best use of that money. The costs are already rising to well over 400 million, so even the available funding is insufficient and may yet throw the whole project into jeopardy. Fifthly, and whilst we are talking about the parlous state of our health economy, let us remind ourselves that the combined deficit of the two CCGs is heading towards a staggering 50 million in the current year. The answer to this appears to be a merger that will distance accountability for the cuts that are bound to follow. None of this is helped, of course, by a chronic legacy of underfunding of the NHS in Shropshire and Telford and Wrekin, even when compared with other areas of the country. Needless to say, our Tory MPs have failed to make any inroads on this issue, despite our lobbying. When the system is in this much debt, what price a sustained and game-changing investment in primary and community care? My sixth point is about mitigation. Since I took over the cabinet role in May, I've seen just how creative and dedicated our staff in adult social care are in driving a public health-led programme of integrated care with our NHS and voluntary and community sector partners at a local level. There is some fantastic and really effective work happening aimed at keeping people out of hospital and residential care and properly cared for in their own homes and their own communities. It is win-win stuff, and for me personally it is an antidote to the stories I hear about failing in emergency treatment services where doctors and nurses are worn down by inadequate staffing levels and increasing demand. But, and it's a big but, unless these primary and community services have proper investment, there is no way that they can deliver at the scale needed to reduce the demand for emergency and hospital care. My final point is about the wider politics of all this. Against the regional and national trend, Labour dramatically increased its majority on Telford and Wrekin Council in the local elections in May. Why was this? Yes, we were well organised and well led, but the main reason we believe is that in the context of the threat posed by Future Fit, we headlined the NHS and talked relentlessly about people's hopes and fears for themselves, their families, their friends and their communities. It was and is a powerful point of connection. We know that a change of government is now the way to stop Future Fit. Yes, we can and will look at local challenges and further referrals to the Secretary of State as more details of the plans emerge, but there is a political imperative behind Future Fit, and that has to be fought politically. In the forthcoming general election, we have every reason to take the same approach as we did in our local elections. In Telford, we will have to switch the focus away from Brexit whenever we can and focus on the things that affect people in their day-to-day lives. Above all, we have to hold our MPs to account for their failure to protect our health services. The two MPs in Telford and Wrekin are currently twisting and turning in the wind as they contradict both each other and themselves over the meaning of the changes and whether they can get away with claiming a victory in the face of obvious defeat. We are determined not to let them get away with this. I hope that some of this resonates with you here in Shrewsbury. I hope you recognise that we have a common cause and join with us in the campaign to come. It's not all over with Future Fit, and it's certainly not over in terms of the battle for our local NHS. The fight, comrades, continues. Thank you.